Hello and welcome to this month's Project You Nutritional Therapy webinar. Today we are going to be focusing on the topic of histamine, MCAS, and the neurodivergent body. Now, I will say this is going to be an info dump. If you've been here before, you know it's always an info dump. So come and go as you please. If you're here live, feel free to do what you need to do in the background. If you're watching the recording, feel free to stop, pause, come back at a later date, skip ahead, do all the things. It's going to be a lot, but this is a very interesting subject, and I think it's a subject that affects so many of us who are living life and experiencing the world in a neurodivergent body. So before we begin, my name is Whitney. I am a nutritional therapist and a trauma-informed practitioner, and I work with Project You as part of their kind of offer for neurodivergent women. And I do the nutritional therapy side of things because that would make sense, right? A lot of my clients, whether with Project You or outside of Project You, are neurodivergent women with complex needs. I am also a neurodivergent woman with complex needs and struggling to say things on a Thursday evening, clearly. This is a educational session. It's not meant to be medical advice. So nothing here replaces the relationship that you have with your GP, specialist, or your own clinician, or your own health practitioner. Okay, this is supposed to be education only. I will say it is a topic that I am very interested in, but I don't want to kind of put myself forward as kind of the expert who knows everything. I have done some research. I have clients with MCAS. I experience histamine intolerance myself. If you feel like something is incorrect or you want more information on it or it needs updating, correcting, I am very open to learning. Please don't think that, what I say is the be all and the end all. I am always welcome to feedback on these topics because it is very hard to be a specialist in everything. I will put a trigger kind of note on today's webinar because we will be thinking about or talking about chronic illness, fatigue, trauma patterns, restrictive eating, all within a clinical context. So again, for that reason alone, if you need to pause or step away, if anything feels too much, you're more than welcome to, okay? And there will be time for questions at the end. If you're watching online, feel free to put questions in the comments or kind of follow us at the Project You Academy on Instagram and fling some questions in the DMs. Or if you would like to get involved and kind of become one of the members, again, just kind of message in the DMs and we will get back to you. Also, if you're watching live, feel free to use the chat, feel free to kind of use the Q&A and kind of I can answer questions as we go along. Now, one of the things I think that we need to kind of just start with, that, neurodivergence is not a kind of chronic progressive illness. So neurodivergence doesn't get worse with age. If your concentration, your brain fog, your memory or processing speed has got significantly worse compared to other periods in your life with similar demands, that's not your neurodivergence, that's your health, right? And this is kind of one of the aspects that might be happening to you or what you might be experiencing kind of if some of your ADHD symptoms, for example, are feeling like they're getting worse, right? It's not that the neurodivergence itself is progressive. It tends to mean that there's a health issue and the health issue we can work with, okay? So the health issue we're going to be speaking about today is MCAS and histamine intolerance. So let's think about the basics, right? So MCAS is thinking about your mast cells. Your mast cells are immune cells, right? They sit in your tissue, particularly at the borders between you and the outside world. So that means your skin, your gut lining, your airways, and around your blood vessels and your nerves, right? So your mast cells are everywhere. They are your body's first responders. So when they detect a threat, whether that's real or perceived, they release chemicals that trigger inflammation as a defense response, right? That's a good thing, right? That's what we want your immune system to do. Your immune system first responders tend to be kind of generalized responders, right? They're not kind of specific. So if you have like a cut, you might end up with kind of things going in more a specific kind of way. But when we're thinking about something that's entered your system, maybe you've eaten something or you've got a virus or a bug or something like that, you tend to have this kind of first response inflammation, right? Or this first immune response, which tends to kind of trigger the inflammation and the defense response, right? This is what we want. This is our immune system working as it should be. So when it's kind of working properly, it's helpful. It's what we need. It starts to become unhelpful when the mast cells are firing too easily or too often. Okay, that's when we start to have a problem. So because they're everywhere, this is why MCAS, so mast cell activation syndrome, can affect everything. And that means skin, gut lining, airways, lungs, bladder lining, around the blood vessels, throughout the body, around the nerve endings, including in the brain, and your reproductive tissue, right? So when we're thinking about MCAS, we're thinking about this whole kind of body, whole systems approach. And mast cells, kind of what do mast cells release? So there are over 200 known mediators. Mediators meaning the things that mast cells release, and each affects different systems. So the most famous one that you'll hear a lot about is histamine. Then we might think about I'm going to have to do words again on a Thursday evening. I don't know why I do this to myself. Tryptase, an enzyme useful for kind of diagnosis. So this is the one that they'll use for the diagnosis of MCAS. Other kind of prostaglandins and leukotrienes. Wow. So essentially we're thinking about kind of the inflammation, the flushing, and the gut motility, right? The cytokines and other inflammatory messengers. So these are kind of some of the ones that are most known. Histamine is what we're going to go into a little bit more today. But what kind of triggers mast cells? What triggers is kind of mast cell reactions? And it's not just allergens, right? It can be almost anything can become a trigger when your mast cells are reactive. So you can think about kind of food and food additives, right? So not just the kind of, oh, it might be gluten, or it might be dairy, or it might be high histamine foods. It actually might be some of the kind of the additives that are in food. It might be kind of MSG, for example, might be the thing that triggers you, right? I'm not saying MSG kind of triggers everyone, but for some people it could do, for example, right? Physical triggers, so heat, cold, pressure, vibration, exercise. Stress, both acute and chronic. So when we say acute, we mean kind of short-term stress. Chronic means long-term stress. We could be thinking about things like hormones, those particularly estrogen. So it might be something kind of in your luteal phase, you're more sensitive to kind of to mast cells and MCAS, right? It could be infections, including viral infections. It could be medications. It could be environmental toxins, mold, strong fragrances. I know you can't put perfume near me. Perfume near me, I'm having some kind of allergic reaction. I can't be walking through some of these shops where they're just spraying perfume at you, because it's just like, hey, hold up, no. And then trauma, physical and emotional, right? So again, trauma would also be thinking about stress, those kind of stress responses, what's going on in your body. So it's not ever going to be a kind of one size fits all, and these things again might change throughout your life. The really important thing to think about as well is when we think about your mast cells and your nervous system. So they don't just kind of sit near your nerves, they talk to them. So when a mast cell releases its mediators, remember the mediators, things like kind of your histamine, your cytokines, right? Those chemically lower the threshold at which nearby nerves fire, which means your nerves can become more sensitive, right? So when we're in a MCAS kind of flare up, for example, we can become more sensitive to pain. We can become more sensitive to external stimulation, or external kind of input in relation to the sensory processing, right? And this is called neurogenic inflammation. And it's part of why MCAS produces such a wide range of pain, sensitivity, and sensory symptoms. And we'll come back to pain in a little bit. And pain is a very important thing when we're thinking about neurodivergence and kind of being within a neurodivergent body. And later on in the year, ProjectYOU will be doing a webinar specifically on chronic pain. So keep an eye out for that. So let's kind of dig in a little bit deeper to histamine. So histamine, as we previously kind of looked at, is one of the mediators, or one of the mediators for mast cell release. So it's something that your body kind of makes constantly for normal functions, right? So it's very normal for us to have histamine in our bodies. It's a neurotransmitter. It's there. It's part of who we are. when we think about it in relation to like a neurotransmitter in the brain, it really helps with wakefulness, it helps with appetite and focus, right? Which is why a lot of antihistamines are kind of can make you feel drowsy, right? Because when we're reducing the histamine, it kind of can make us feel a bit sleepy because too many histamines can make us feel quite alert and quite wakefulness, right? So a lot of the medication will have the opposite effect and make us more drowsy. It can trigger stomach acid release, which means that there is a link between histamine and acid reflux, and MCAS and acid reflux, which we'll look into a little bit more later. It's part of a normal immune signaling, and it can cause itching, flushes, and hives when in excess. So histamine itself is not the enemy. The problem is when there's too much of it or when the body can't clear it fast enough. So when we're thinking about kind of histamine and MCAS and kind of a lot of us who have these kind of reactions to it, we tend to be thinking about it kind of in two different issues. It can be our body's producing too much of it or we can't clear it fast enough. And in a lot of cases, it's both of those things working together. And I will just keep repeating that message throughout the day. So, where does histamine come from? There's three sources and they all matter. So, it is made in your body by the MCAS cell, by the mast cells, like we've said, and other kind of immune cells. It can also be found in food, particularly aged food. So, like if you get a steak, for example, from the shop, you tend to see and it'll be like, oh, this has been aged for 30 days. That's what it means. So, food that's kind of been left to kind of develop its flavor. Fermented food, so things like kimchi, sourdough, they would be kind of considered fermented food, sauerkraut, even a lot of yogurts, leftover or cured foods. So again, like the aged cheese, wine, meats, and fermented foods, smoked fish, for example. Leftover foods, I think, is an important one just to put a little bit of emphasis on because many of us at kind of Project You are involved in training and sports and wanted to become more athletic. And a lot of what we then want to do is meal prep. And sometimes meal prep can be really good for us, but if we are dealing with high histamine or MCAS, actually meal prep in itself can kind of raise some of our histamine levels because as soon as food's left over, it starts to ferment. That kind of fermentation kind of builds up histamine in the food, on the food, and then we consume it and it kind of increases our histamine levels internally, which is all right if we are able to kind of deal with it and detox it kind of as we'd like to, but if we don't, then it can become a problem. So it's always one of those things that we have to be careful of if we're meal prepping. And then we'll give you some hints and tips on how to deal with that better later on in the webinar. And it's also made by your gut bacteria when they break down protein. So some strains kind of produce far more histamine than others. I'm not going to go into the specific kind of strains of bacteria in this webinar today because the webinar's long enough, trust me. But it's something that you might kind of want to go in your own rabbit hole down and explore a little bit further. So let me just round that up. So it's kind of made in your body by the mast cells. It can be found in food, and it can also be made in your gut bacteria. So how does histamine kind of get cleared? There's two main routes and both are important and both are quite vulnerable to disruption. So you have the DAO, which clears histamine from food in the gut. And in order for your DAO to kind of work efficiently, it needs vitamin B6, vitamin C, copper, and zinc. We also have the HNMT, which clears histamine inside cells in particular in the brain and the immune cells. So this depends on methylation, and we'll return to this in a few slides. So if either of these systems are impaired through nutrient deficiencies, so say if you don't have enough kind of B6 or enough zinc in your body, if you have kind of genetics, which might kind of change your the way that you methylate, if you have gut inflammation, or if you're on certain medications, so NSAID, so non-steroidal anti-inflammatories, so things like ibuprofen, for example, and some antidepressants, it can also kind of mean that histamine kind of builds up. And some people are clearance impaired, so some people are kind of release overactive, and many are both. So sorry, some people are clearance impaired, so they don't clear out the histamine as effectively, and some people produce too much histamine, and many are both, right? So it can either be an either or it can be a both. So MCAS versus histamine intolerance, what's the difference and does the difference matter? So the headline kind of distinction is they can both exist together, and in the population that we're talking about today, so in kind of neurodivergent people, they often do. So histamine intolerance tends to be around a problems of clearance. It's your mast cells behaving normally, but your body just can't break down the histamine fast enough, especially when it comes from food. And it's largely a load clearance equation. Where MCAS, so mast cell activation syndrome, it's kind of in the name, is a problem of release. The mast cells are firing too easily. There's too many mediators released across multiple body systems, and the triggers are more than just food. So histamine intolerance in practice, symptoms cluster after eating high histamine foods. So what you might find is there's headaches, especially after something like red wine, aged cheese, or chocolate, God forbid, not chocolate. You might have some flushing, you might have some nasal congestion or runny nose. I see a lot in relation to nasal congestion in my clients when we're thinking about histamine intolerance or MCAS. You might also have bloating and loose stools. You might have itchy skin and difficulty falling asleep after a histamine-rich meal. Remember what I said before, that histamine can kind of create wakefulness. MCAS in practice, so systems might appear across multiple body systems and respond to far more than food. So you might kind of in relation to your skin, you might have the flushing, the hives, the itchiness, the rashes, the dermographism in the gut, might be things like bloating, nausea, IBS-like patterns and food restrictions, cardiovascular, rapid heart rate, blood pressure swings, dizziness in your respiratory system, wheezing, breathlessness, chronic congestion, neurologically, brain fog, headaches, anxiety, sensory sensitivity, and this kind of whole body fatigue, post exertion crashes and temperature dysregulation, right? And if you're familiar with POTS and dysautonomia, you'll start to see already there's some overlap here. So we can also see that how this will get picked up later on, but also kind of when you're in a body that's experienced dysautonomia and POTS, you know, when we're in an MCAS flare, it might also kind of exacerbate a lot of those symptoms as well, right? So that especially like that temperature dysregulation or that kind of the post exertion crashes. So that might be from work, that might be from the gym, that might be just kind of things that would normally not take too much out of you, but what you're finding is actually you might go out and be social and you need a day or two to actually recover from that, right? So histamine intolerance is about clearance, MCAS is about release, and they can both be true at once. So why does this matter for neurodivergent women in particular? So we have the triad, right? And this is what I was talking about before. So there's three conditions that kind of travel together more often than chance would predict. And it's particularly within the kind of the neurodivergent community, we kind of see this in. So hypermobile Ehlers-Danlos syndrome, so HEDS, or hypermobility spectrum disorder. Also other kind of variants of EDS as well, right? I am generalizing a bit here. We might be thinking about POTS or dysautonomia, like I said previously, and then again, the mast cell activation syndrome. We kind of see this as a bit of a triad. If someone is kind of has hypermobile EDS or some sorts of dysautonomia, I tend to think, oh, they probably have MCAS as well or some kind of histamine intolerance, right? These things tend to cluster together. Not always, but kind of from my experience and kind of from what research says, we do see an overlap kind of in a lot of cases, right? So the neurodivergence overlap, autism and ADHD are significantly overrepresented in the HEDS, POTS, and MCAS population. So you don't necessarily have to have or be autistic or have ADHD to kind of have MCAS. Neurotypicals can deal with MCAS as well, but we know that with autism and ADHD, there is kind of there is that higher representation, right? We are more likely to deal with HEDS, POTS, and MCAS, right? And this is likely a combination of shared genetic factors, that some genes affect connective tissue and brain development, the shared autonomic patterns, and the long-term effects of chronic stress on a body already running kind of differently. This is not a kind of neurodivergence causes MCAS or the other way around. They just share the same roots. And the histamine ADHD connection. So histamine is a neurotransmitter involved in attention, wakefulness, and impulse control. When mast cells release excess histamine, it can affect brain function. So it can create racing thoughts, difficulty focusing, emotional dysregulation, and disruptive sleep. For someone with ADHD, MCAS can make their symptoms worse. And for someone without an ADHD diagnosis, MCAS can, or that doesn't kind of suspect ADHD, MCAS can actually produce symptoms that look very identical to ADHD. One of the things that we noticed kind of in the COVID pandemic was the fact that, after the pandemic, a lot more people were realizing that their kind of ADHD was harder to manage or that they were needing additional support. And a lot of that was the link between kind of COVID and MCAS and how a lot of people were developing long COVID and that was whacking up their ADHD symptoms. But I do have a slide on that. So one of the things that I was actually asked to kind of put this into this webinar as well from another practitioner who does work in this area. So I would, sometimes we talk behind the scenes and we think about kind of what are some of the patterns that we see, right? It's important to understand that kind of pouring ADHD stimulants on top of MCAS related fatigue is a shortcut to a health crisis, and it will be a short-lived boost with a massive crash. And I think we see this a lot in the corporate world where people are kind of having these kind of big MCAS flare-ups, not knowing that they're MCAS flare-ups, thinking it's kind of their ADHD has gone into overdrive, will use a lot more medication or go back to the GPs and be like, I've got all of this fatigue. Can I have more medication? What can I do to help this? And going kind of through the route, looking at things through the lens of ADHD. And actually, the MCAS is kind of, they're in a health crisis, right? Their MCAS is flaring up and the MCAS needs to be dealt with. If it's not dealt with and it's just put more ADHD stimulants on top of this, then actually you're probably going to end up in burnout or in a massive kind of health crash afterwards, right? So to think about this in relation to like, this may have been with you your whole life, it may have been showing up in childhood, but it just might not have been seen through the lens of histamine or MCAS, right? Or it might have kind of got progressively worse after an illness, after a highly stressful time in life. But in childhood, it might look like kind of chronic ear infections, right? And everyone that's kind of with ProjectYOU that's done an assessment with me has heard me ask, have you had ear infections as a child? Kind of, have you had tonsillitis? Have you had these kind of things, right? Because this is what I'm thinking about. It might be kind of sensitive skin. It might be motion sickness. Oh my God, motion sickness. I cannot do roller coasters. I think I maybe used to do no, I don't think I did roller coasters very well as a child anyway. I just kind of tried my best. I went to an amusement park last year or the year before and I had to come home, tap out. It's not working for me. But like MCAS and motion sickness or kind of vague food reactions, difficulty with extreme temperature, unexplained tummy aches, repeated reactions to like plasters or cosmetics. For those of you who are sexually active as well, it might also be things like condoms you might have responses to as well. Hives that come and go, getting flushed easily. If you're watching this and thinking like I've always been like this and it's just got worse, that's information, that's data. You're not exaggerating, right? These things can kind of get worse over time. But like I said previously, it's not that your ADHD is getting worse. It's probably that your MCAS is getting worse or your histamine levels are a lot higher. And what we need to do is kind of support that aspect of things. Chronic pain and the mast cell connection. So this is again really important because a lot of people that have kind of that we work with at ProjectYOU, for example, and especially in relation to the EDS, the POTS and the mast cell kind of triad as well, we tend to see a lot of pain, and that chronic pain is kind of a lot of the time contributed to EDS and hypermobility, which is true. Hypermobility and EDS do cause chronic pain. But if you're in a mast cell flare up, that pain is going to be heightened, and the mast cell kind of or the MCAS can actually make the nerves more sensitive, right? So over time, it also contributes to chronic pain syndromes. But this doesn't have to just be the kind of the EDS. We might be thinking about things like fibromyalgia, small fiber neuropathy, um, vulvodynia, dynia. I I Googled earlier how to pronounce this word and it's gone from my brain. Um, Essentially, we're talking about kind of pains and yeah, pain and soreness around your vulva area, right? Cystitis and chronic migraines. Migraines being an interesting one, right? Because migraines we don't necessarily connect with mast cell, right? We very few people kind of know that there is a connection between kind of chronic migraines and kind of MCAS. And that's not always going to be, it's not always every single chronic migraine is MCAS, but we do know that there is a connection there, right? So again, so people with heads, the joint instability adds another layer, but the underlying pain sensation is often kind of mast cell driven or kind of MCAS driven. And this is one of the most kind of undertreated aspects of chronic pain. People are given painkillers when their nervous system is being lit up by mast cell activity. And again, that kind of mast cell histamine painkiller can actually then create a loop because your painkillers can also kind of flare up your histamine levels. So it can kind of be one of those really difficult loops that you kind of get into and you struggle to get out of because then you take more and more painkillers because of the pain sensitivity and the chronic pain, and actually the painkillers are flaring up your MCAS, they're flaring up your histamines, you know, and they're contributing to it. So it starts to kind of roll out of control, especially before when we were thinking about kind of NSAIDs. So ibuprofen, for example, like an anti-inflammatory. How many of us will be in chronic pain and will need to take the anti-inflammatory for the chronic pain? And actually, what damage is that also doing to our bodies? It puts us on this bit of a kind of catch 22. Um, so what else could it be, right? So the important thing that when we're thinking about MCAS and histamine, and if you're watching this and you're thinking, oh, I have all of these symptoms, right? We have to also be careful and think, you know, it's not always histamine and it's not always MCAS. And there are other kind of possibilities, other causations, and it could be it doesn't necessarily have to be one or the other. It could be a multitude of things, right? So if I was sitting there thinking, okay, I'm listening to this webinar and I feel like, you know, some of this really rings true to me. Some of the things that I'd also want to kind of go to my doctor and maybe kind of talk about or think about kind of within myself is, do I have any thyroid dysfunction? So I might want to get a thyroid panel from my GP and just to make sure that all my kind of thyroid what's the word that I want to look for? Everything within my thyroid is working as corrected. Like I've got enough T3 cells, enough T4, nothing's kind of too many or too less. I'd be looking at iron deficiency. I'd be looking at B12 deficiency and folate deficiency. Folate is a really important one with neurodivergent people, because this is where I tend to see the biggest deficiency with a lot of my clients. So a lot of my clients will be going to the GP kind of once a year to have like an injection to get more folate, because they are that deficient. Sometimes this deficiency can come through food and not getting enough, not eating kind of a variety of food. So if you're eating the same foods every day, then you might kind of be folate deficient that way. If we're vegetarian, for example, you might end up with a bit of a B12 deficiency or an iron deficiency. So it depends on kind of how restrictive your kind of diet and your eating patterns are, which might create kind of these deficiencies. It also might be related to some of the genetic differences that neurodivergent people have. So we might have issues with our methylation, which means some of our B vitamins, like our B12 or our folate, we would need them in a kind of slightly different format. So a methylated multivitamin or a methylated B vitamin complex might be more appropriate for for our bodies to be able to use the B vitamins or the folate, the B12 in the kind of correct kind of way. We just need it in a slightly different format kind of entering our body. We also might be thinking about perimenopause and hormonal shifts. There's more research coming out now to showcase that people with ADHD and those of us with heads might actually experience perimenopause 5 to 10 years earlier than our kind of counterparts that aren't ADHD or don't have EDS. It might kind of come from sleep apnea. So we'd be looking at someone's sleep, how they sleeping first. So again, a lot of the times before in nutritional therapy, before we go into testing, before we start thinking, oh, this could be histamine or MCAS, you look at the basics, what are you eating, what are you sleeping? If you're not sleeping you're not sleeping well, or your sleep schedule's all over the place, so you're not feeling rested after you sleep, we'd work on sleep first, sleep and food, and we see how things kind of might change in that way. And then we'd start thinking, okay, maybe this is something a little bit more than just a kind of sleep apnea or kind of vitamin and mineral deficiencies, right? Long COVID, do not underestimate the power of long COVID. And there is a big link between kind of long COVID and mast cells, right? And there was actually a really good conference put on by the Royal Association of Medicine. I think it was last year, could have been the year before, because time just flies at this point in life. Looking at the kind of the association between hypermobility and hypermobility EDS and long COVID, and there was a big overlap there. So like the hypermobile community was very much affected by long COVID, and we believe that's because of the MCAS and the histamine issues, right? So a lot of the time when I think about long COVID and when I'm treating long COVID, I'm looking at it through the lens of kind of mast cells as well. Not all the time, but majority of the time. Trauma-related autonomic dysregulation, never underestimate the effect that trauma can actually have on your body. And that's not to say that it's irreversible. It's we can heal our bodies, but like it can have huge impact on our autonomic nervous system. So our autonomic nervous system being the involuntary aspect of our nervous system, so the bit that kind of regulates our temperature, helps with our breathing, kind of keeps us kind of maintaining a this kind of equilibrium in our being. So if that is dysregulated, it can have a huge kind of knock-on effect. And a lot of us, a lot of us when we're neurodivergent have been affected by trauma in childhood, let's be real, or a lack of attunement, or kind of some kind of an emotional neglect, or in situations where we've grown up and we're not able to feel all of our feelings, and we kind of really kind of sit on them and don't know how to express them, and we'd end up developing a lot of resentment. And these things can also give us heart palpitations and make us sweat and kind of dysregulate our bodies and all of these kind of things as well, right? Autoimmune conditions, and we're going to do a little bit more on this shortly as well. So again, autoimmune conditions can also kind of create some of these effects. And so again, this is what I mean about this webinar is educational. It's about kind of supposed to be giving you some information. We're not trying to diagnose you. I'm not trying to get you to the point where you diagnose yourself. I want you to have some information and then kind of maybe go and speak to your doctor about some things. So the big triggers: stress and the nervous system. So mast cells have receptors for stress hormones. So when the nervous system goes into a sustained stress response, mast cells are activated. For neurodivergent women who spend years masking, navigating sensory overwhelm, and managing rejection sensitivity, the baseline tends to be a kind of high stress load. And this is not stress is causing MCAS in your head. This is real, measurable crosstalk between your stress system and your immune system. And the implications of this is a nervous system regulation. The implication of this is nervous system regulation is part of treatment. It's not an optional extra. It has to be part of protocol. And I know if you're my client and you're watching this, you're like probably getting so fed up of all the conversations that I have about your nervous system health, and how are you feeling, and where's your anger sitting, and kind of all of these kind of things. But these things are important. Again, let's go back to long COVID and MCAS. I've said it before. I'm actually speeding through this. I thought this webinar was going to be about 90 minutes long, and I'm wondering if I'm even going to make it to the hour at this point. Maybe I took too many slides out, but let's see where we get to by the 60-minute mark. So long COVID and MCAS. So a significant proportion of long COVID presentation looks like new onset MCAS, POTS, or both. Okay. And I also know, a lot of us did end up getting COVID and having long COVID. I was right there with you. It took me about a year to kind of really get over it. It was a lot to deal with. So the leading theory is that the immune system gets stuck in an activated state post-viral, and MCAS, mast cells are central to that. Now, this doesn't always have to be long COVID. This can also just be viruses in general, and how kind of you can have post-viral fatigue from viruses as well, and how that interlinks with your mast cells. If you see me kind of looking over there, my cat is asleep on the windowsill and he looks so very cute. And I'm sorry, but I can't show you because I can't turn the computer around that much. But he just looks adorable right now. Sorry, that's my ADHD going on a side quest. But for many people, long COVID was the trigger that tipped a previously kind of coping body into full MCAS. And this is why kind of post-COVID pandemic, we are seeing a lot more kind of neurodivergent people feeling a lot more disabled and feeling like they're less able to do a lot of things that they could do pre-pandemic. And that is how kind of long COVID or a kind of COVID kind of came into their system and kind of tipped the body over into MCAS. And actually what they're dealing with now is MCAS. And a lot of the times I don't realize that. They're thinking, oh, my ADHD has got worse. Is this because I'm working from home? Is this because we got so much time off and then I've had to go back into the office? Well, it could be some of those things. But let's check out what's kind of going on with your health and well-being. Okay. So again, kind of thinking about what I said before around, this isn't about your neurodivergence getting worse. This is something going on with your health. So you have to be really careful that you're not kind of getting into this cycle of I'm going to use my medication, my ADHD kind of stimulants in order to kind of power through this fatigue. Actually, let's slow down and see what might be going on for your body, and let's see if we actually need like an MCAS protocol to kind of help clear some of this histamine out of your system. So pre-existing mild MCAS or histamine intolerance often gets significantly worse after COVID. If you've developed unexplained multi-system symptoms after a COVID infection or any infection, any kind of virus infection, this overlap is always worth investigating. Perimenopause and MCAS. And actually we can also kind of, I know last month we did PMDD, and we could also look at this through the lens of PMDD. There is also information out there that suggests that there are that MCAS can affect PMDD, can affect OCD and exacerbate OCD symptoms, PMDD symptoms, as well as other what's the word, essentially mental health conditions. There was an official word for it. If you'd want the paper to read through, message me, let me know, and I can give it to you. But there was an actual research paper that came out that was looking at MCAS in relation to more psychological symptoms or psychological conditions like PMDD, like OCD, anxiety, depression, and these things. So estrogen and mast cells interact directly. Mast cells have estrogen receptors, and estrogen can both trigger mast cell activation and slow histamine clearance. So again, this might be something that you deal with more in your luteal phase. This is why so many women report a worsening of unexplained symptoms in their late 30s and 40s, even before they think of themselves as perimenopausal. So cycle patterns, so worst in the second half of your cycle, worst around your periods, worst during your ovulation, are a strong cue. Perimenopause doesn't cause MCAS, but it can unmask it or worsen it significantly years before, like the hot flushes appear. So burnout and MCAS. Burnout, particularly the long running kind from chronically masking neurodivergence, working in helping professions or carrying caregiving without support, depletes the body's regulatory reserves, right? Carrying caregiving without support, I think that is also one to mention for neurodivergent women because we tend to get ourselves in relationships with partners who require a lot of caregiving, to say nicely, which means we tend to be taking on a lot of the emotional and physical load at home. And we won't necessarily see it as caregiving, but there will be an inequality in the household, and we will make all the excuses in the world for the person that we love. And we can do a webinar on that on another day. But I think it's important to understand that that can also be caregiving when we're in a relationship that is unequal, and in a relationship where we're abandoning self in order to look after our partner. That also is something that can deplete our own body and put us in or keep us in burnout. And then that also will have a relationship with MCAS. So this kind of dysregulated nervous system, it can disrupt sleep, it can alter gut function, reduce the capacity to dampen the inflammation. For someone who is predisposed to MCAS, burnout can flip a manageable presentation into a debilitating one. For the practitioners that are watching, for those that kind of want to watch the recording of this, we are not separate from the patterns that we work with. The work we can do the work that we do can also be a direct contributor to our own health and collapse. I'm sorry, I need to change the way that I'm sitting because I'm also hypermobile, and sitting for too long in one position hurts, frankly. So let's kind of start putting together. There is no single cause. This is a pattern of a accumulated load that eventually tips into a system already running at the edge, right? So we might be thinking about a genetic predisposition. There are genetic tests you can get for, not necessarily for MCAS, but to kind of look at histamine and how histamine might be kind of working through your body. It might be looking at kind of if you have any genetic markers that might mean that you produce too much histamine or not enough histamine. I tend to do these tests privately rather than going through the GP. The GP does different tests. Infections, including COVID, hormonal shifts, chronic stress, trauma, burnout, gut dysbiosis, and feeding into a kind of destabilized mast cell system. So it could be a couple of these, it could be a few of these, it could be a lot of these. I think the whole trauma, stress, chronic stress, trauma, burnout is a big thing for a lot of us anyway. So again, let's looking at the wider picture. So the autoimmune overlap. So autoimmune conditions cluster with MCAS. One autoimmune condition often comes with others, and the same is true for MCAS. So some of those we might think about is Hashimoto's, celiac disease, endometriosis. So endo is a particularly interesting one because a lot of neurodivergent women that I know deal with endometriosis, and there is starting to become more research that shows that there's this kind of significant mast cell involvement in pelvic pain. So one of the things that we might be thinking about kind of as we move forward is if someone is presenting with endo, is actually would they benefit from some of the treatment for MCAS? Are these things actually more related than we realize? Lupus, arthritis, rheumatoid arthritis, autoimmune gastritis. Again, these things can have common overlaps with MCAS. And what we might find is by working with the MCAS, we can reduce some of the other symptoms. So it doesn't mean that you cure the autoimmune condition, but it might mean that the symptoms aren't as exacerbated, kind of aren't as these debilitating kind of thing. So mast cells contribute to autoimmune flares, and autoimmune inflammation activates mast cells, and the systems kind of feed each other. So you wouldn't work with them separately, you would work with them together. the gut, your bacteria, and your histamine load. Oh, I wish I had more resources so I could really just go down a rabbit hole and really like just spend like a year of my life studying gut bacteria. I'd be so happy. I would be so happy. Let me just spend like or even a day a week just thinking about gut bacteria, right? Because it's fascinating. I feel like we are just like these walking universes of bacteria. Like we're just here for our bacteria to exist because there's so much bacteria kind of within our being, on our being. But gut bacteria kind of fascinates me. Sorry, I'm getting a little autistic right now. I'm gonna wheel it back in. So it's important to understand that some kind of gut bacteria can produce histamine. They take the protein from your food and turn it into histamine inside you. Um, Again, I'm not going to go into the details of all the kind of unique histamine all the unique kind of strands on this. You can go and do research in your own time, or if you're a client of mine or want to talk to me about it, we can have a chat about it. Um, but gut inflammation itself also reduces DAO production, so you clear less of what you do take in. So this is why things like dysbiosis are important as well, or if you are allergic to gluten, but you have a intolerance to gluten, for example, and you keep eating gluten, or you have intolerance to dairy and you keep having dairy, what you're going to do is inflame your gut and that will have knock-on effects. So one of those knock-on effects could be that it reduces the DOA production, which means it clears less of the histamine, which means you have like a bigger kind of histamine load within your system. So working on gut is a kind of a foundational thing to do in most practices. It's not alternative to medication, but it's the layer underneath. So from a nutritional therapy perspective, I said previously we work on sleep and gut health, and then kind of what are you eating. All of these things are kind of the fundamentals. Actually, for many of us, if we can work on our gut health and our sleep, a lot of our symptoms will reduce anyway, and we don't even have to get into like the nuances of MCAS and histamine lows, right? um if you're dealing with poor health now, and you don't have, you know, a health practitioner, you don't have the money for nutritional therapy, I'd always say speak to your GP. But one of the things that you can really kind of look into yourself, and one of the things that you can think about is, you know, how do you look after your sleep and your gut? That's where I would start. So one of the cautions on probiotics. So not all probiotics are histamine friendly. Some commonly sold probiotics contain strains that increase histamine production and can make MCAS significantly worse. So sometimes we might be working with the best intentions and be like, oh, I had this virus or I had antibiotics, and now I'm going to have, you know, some probiotics just to help my gut. And actually we take some that have strains that just kind of lead to more histamine in our system. So we'll want to look for kind of histamine degrading or histamine neutral strains. Always avoid products that don't kind of put the specific strains on their labels. This is kind of one place where good guidance from a knowledgeable practitioner is genuinely worth it. So why is diagnosis so difficult? So MCAS is a the MCAS diagnosis is relatively new in mainstream medication, but many GPs have not trained in it. Many GPs don't know what it is, and with some GPs, you actually have to have a bit of a fight with them for them to do any testing or kind of give any treatment for it. The diagnostic criteria requires specific blood and urine tests done during or just after a flare, and you often need to know in advance you might be having one. Um, like I say, there are kind of genetic testing that you can also do privately. And if you're interested in that, I can get that done for you. On the NHS, getting these tests is difficult, and you often need a referral to a immunologist or an allergist with longer waiting lists. And most people with MCAS are either undiagnosed, misdiagnosed, or end up in private specialist care. This is a kind of real problem in relation to access. And if you know me, I have a big history in social justice, and I think, you know, we don't ever leave social justice out of the picture. So one thing to remember, that in some kind of extreme cases of MCAS, people do require emergency care. So if you ever have suspected anaphylaxis, I think that's how you say it, please go to 999. My cousin, uh, or please call 999, please go into A&E. My cousin decided to not do that. And she waited, and she has an EpiPen, and she went into A&E kind of hours later than she should have. And sorry, my cat is causing chaos. And the doctors were like, "Do you have an EpiPen?" And she was like, "Yeah." And they were like, "Why didn't you take it?" And she was like, "Oh, I didn't think it was severe enough." So learn the lesson. As soon as you feel like you are kind of going into that kind of anaphylactic shock, if you have an EpiPen, use your EpiPen. Use your EpiPen. Um, so you might be thinking about sudden flashes, swelling of lips, tongue, and throat, difficulty breathing, sudden drop in blood pressure, fainting, or a sense of impending doom. Always call for help. Don't feel like you're overreacting. Call for help. It's better to call for help and not have an issue and to feel a little bit silly, like, oh, I got a bit scared and I called for help. It's always better to do that and not have an issue than to have an issue and not call for help because you feel like you're being silly and you feel like you're overreacting, right? Always call for help if you feel like you need help. So drugs and medication can be triggers. So like we said, the NSAIDs, NSAIDs, so ibuprofen, aspirin, naproxen. I think I said that right. For other medications like kind of opiate medications, and again, so like your opiate medications are going to be triggering your MCAS. So when we have clients that are being given opioid, kind of the like the stronger painkillers for their pain, but then it's flaring up their MCAS and we're just getting caught in loops. Sorry, I need to let my cat out. Given up trying to be professional whilst being a cat mom because these things just don't intertwine. Some antibiotics could also kind of cause flare-ups, some contrast dye for CTs and MRI scans. Some of the general anesthetics used and muscle relaxants used in surgery, some antidepressants and sedatives. It's always good to actually bear in mind that if you're going to go have any surgery, if you're autistic, ADHD, but particularly if you're autistic, but particularly if you have POTS or EDS, always let your doctors know, always let your surgeons know, because we can actually respond quite differently to anesthetics, and it's at this point, you know what I mean. It's on the screen. Just read it. It's okay. I can't see words clearly. So having MCAS doesn't mean that you can't take any of these. It just means be careful. It means kind of advocate for yourself carefully. Mention it to your kind of prescriber, your doctor, whoever you're working with, carry a written list. Speech can fail when you're stressed or unwell, so it's always good to have these things kind of written down as well. For planned surgery, ask for pre-medical protocol. Specialists usually use standard protocols to reduce reaction risk. If you've reacted to medication before, that information should always go onto your records and be part of every clinical conversation. Again, as well, if you're going to the dentist and you're having these procedures done, make sure you brief your dentist before. You're not being extra, you're not being silly. These things are important. You know, think about kind of pre-medication with antihistamines before the appointment is helpful and is standard advice from MCAS specialists, right? So treatment, a note before treatment, if you suspect MCAS, the first step is always a conversation with a knowledgeable GP or specialist. Self-treating moderate to severe MCAS is not always a good idea, particularly because of the risk of reactions and medical interactions. There is plenty you can do alongside specialist care, but understanding the structure of treatment helps you advocate for yourself. So there's 4 tiers, each building on the last. Most people don't need the upper tiers. So tier 1 is always kind of antihistamines. There are different types of antihistamines. Your H1 antihistamines are for skin, airways, and brain, and your H2 is for gut. The H2 tends to be the one that has to be prescribed by your GP. It's not something that you can get over the counter anymore, I don't believe. But a lot of the H1 blockers are the ones that you do get in the supermarkets. So you might start with a H1 blocker, and then kind of speak to your doctor about getting a H2 blocker for some of the gut symptoms. Excuse me, darling, can we just, if you sit there, that will mean you're completely out of the way. And with these, you'd be kind of giving it about 4 weeks before drawing any conclusions. Tier 2 is mast cell stabilizers. So again, thinking about what you can get from your doctor and from your pharmacy. So these are some of the ones that you might want to speak to about with your doctor, with your pharmacy or kind of pharmacist. That's the word that I want. Some of the things that you can get, kind of just supplements. So you can get from, I try to say don't go to Holland and Barrett, because a lot of the time that they kind of have a lot of crap in a lot of their supplements. I tend to go to somewhere like the Natural Dispensary, because I know that they're kind of slightly better. I like brands like BioCare. I like brands like Cytoplan. I don't get paid from them to say that. But you might be thinking about things like quercetin or vitamin C. However, if you are on ADHD medication, don't take vitamin C supplements with your ADHD medication. Split them. There should be about 2 hours in between, because your vitamin C can affect how your body uses your ADHD medication. Okay, so you don't take no orange juice, no vitamin C supplements with ADHD medication. Wait for about 2 hours before you take those. So tier 3 would start being like the more kind of targeted specific mediators. So again, you know, these are things that I'd like you to speak to your doctors about. This isn't something that I'd say go and just kind of go and get over the counter and do, but kind of giving you the information that you can go and speak to your doctors with. Again, so here though, you might want to try a low histamine diet to see if that helps to stabilize systems. I mean, you can use a low histamine diet kind of at any point throughout this, because it's not going to cause any harm. But it can be quite restrictive. So kind of if you're in a place where, you know, you've got a lot of brain fog, there's a lot of kind of executive dysfunction going on, it might be a little bit harder to try kind of low histamine diet kind of as the first step protocol. And then tier 4 are your advanced options. And again, these would be through your GP, but I'll leave them here in the slides for you to be able to kind of talk to them about it. And just again, to reiterate, yeah, I'm not an expert in allopathic medicine. I'm not an expert in I'm not a medical doctor. Okay. There might be GPs that challenge this. There might be GPs that disagree, and that is okay. Listen to your GP. I do the nutritional stuff, so I can do the supplements and the food stuff. That's my expertise. That's what I've been trained in. If a GP kind of says, no, let's not do it this way, or there's other evidence, listen to your GP first when it comes to medication. I think kind of, well, we are going to go slightly over, but that's okay. So the thing that's really important to understand, and what runs through kind of each of these tiers, is pacing is important, right? Pushing through makes you sicker. Pacing isn't lying down and giving up. It's slowing down in order to get things right, okay? This kind of post-exertion malaise is real. A delayed worsening of symptoms after activity out of proportion to what is done. So this kind of feeling like, oh, I've only done this one gym set. Why do I need to sleep now for the rest of the day? Or I've only done this one appointment. Why do I need the day off in order to recover, right? Completely, like it's part of kind of MCAS. It's part of kind of what happens when we're in a flare up. You know, it's not that you're doing anything wrong. It's actually the symptoms do get worse, and you do need more time to recover, right? Pacing is the discipline of working with your current energy, and like slowly expanding it, right? If you've only got a small amount of capacity, then that's what we work with, right? It doesn't mean that you're a failure. It doesn't mean that you're doing anything wrong. It's just we're working with where you're at right now. And this applies to the physical, the cognitive, and the emotional effort, right? All of these kind of pull from the same well. And for most people who do this work consistently, it's a phase and not a forever state, right? And we can get you back to the point where, you know, you're not in a flare up anymore and you are feeling a lot better. And I say this as someone who has been in many of flare ups and has had some very severe flare ups and is currently thriving, touch wood. Currently doing really, really well and not experiencing any of the big symptoms. And even feeling like kind of managing autism and ADHD kind of is not as huge as it's been in other parts of my life, right? It's not a forever state. So the other thing that runs through every kind of tier is nervous system regulation. So mast cells respond directly to stress hormones. Practices that down regulate the nervous system kind of reduce mast cell activation. Breath work, time outside, sensory regulation, trauma-informed therapy, prioritizing sleep, meaningful pleasure. We developed the idea of an anti-gratitude diary earlier on with one of our clients, which I think is brilliant for those of us who need to kind of get out some of our anger and our rage. Many of us need to get out our anger and rage, let's be real. For neurodivergent in women in particular, accepting that you may need more kind of recovery time than the average person or a neurotypical person or whatever. Like, it's just part of the part, right? We need to stop comparing ourselves to other, right? And this is not optional. This is not a luxury. Nervous system regulation needs to be part of our kind of day-to-day life. So just going through the last bits here. Your gut is one of the biggest reservoirs of mast cells in your body. Food provides histamine directly, supports or undermines the bacteria that produce and degrade histamine, and gives you the nutrients you need to clear enzyme or for your clearance enzymes. Diet alone is rarely enough for moderate to severe MCAS, but is foundational. For mild histamine intolerance, it can actually be transformative. A really important caveat first is your relationship with food is more important than getting the perfect MCAS diet. A low histamine diet is a restrictive eating protocol. So for any of you that are watching that have a current or past eating disorder or disordered eating tendencies, a difficult relationship with food, this needs careful handling, right? So do this with a practitioner. The mental health risk of triggering disordered patterns can outweigh the physical benefits of diet. So if this is you, please work with a practitioner who understands both eating disorders and MCAS before attempting dietary changes. The principles of low histamine eating. So it is not a forever diet. It is a temporary tool to reduce load while you work on the underlying picture, right? So the low histamine protocol is a tool. It's not supposed to be the thing that you have forever. When we're thinking about low histamine, we're thinking fresh is better than aged or fermented. Cook and eat the same day where possible, as leftovers accumulate histamine quicker. Freezing food immediately after cooking it preserves it without histamine buildup. I mean, obviously let it cool down first, right? I know some of us think very literal, and I can do that as well. Let the food cool down, then freeze the food. During a flare, avoid the obvious. So avoid your aged cheese, your wines, your cured meats, your fermented foods, and smoked fish. Be aware of histamine liberators like tomatoes, citrus, strawberries, chocolate, and alcohol. Strawberries in summer can be deadly because they are everywhere. And we go, oh, they look so nice. I want a straw. I did it the other week. I was like, oh, those strawberries, they look so nice. I completely forgot. And I went home and I had the whole tub of strawberries thinking, oh, look at me. I'm so healthy. I'm doing so good. Look at me having fruit. And ended up in a histamine flare up for like 2 days. Like it was not worth it. So some of these things we just have to be mindful of. Again, spinach would be another one. A lot of us will eat spinach thinking, yeah, I'm trying to be really healthy. Look at me go with my tomatoes and my spinach. And actually they could be kind of liberators. They could be kind of increasing our histamine load. A note on dietary information online. So histamine foods or kind of lists online can vary and they can contradict each other. This is because, sorry, I thought my cat was eating my chair. This could be just because based on like freshness, processing, and how individuals react, right? We can all react differently to the same things. Do not scratch my jaw. Your reactions are more reliable than any list, right? So keep a food and symptom diary if you're investigating. So if you're thinking, I might have an issue with histamine, get a rough understanding of what the foods are that kind of that they're said online, but keep your own diary, because what you might find is some things you react more to, some things you're fine with, and in fact different times of the month you might be more reactive or less reactive as well. So another thing we wanted to be doing is supporting your gut. So we want to be to wanting to reduce inflammation. So treating any kind of underlying issues like SIBO, IBS, or kind of celiac if relevant. Be cautious looking at probiotics. So again, we want to be thinking about kind of avoiding products that don't specify, and also kind of thinking about kind of what are histamine degrading and neutral strains. Bone broth made with shorter cooking times is gentler on histamine load than long simmered versions. Probiotic fibers feed the bacteria that you have, both helpful and unhelpful. So again, you'd want to introduce slowly, as he is doing the most. Sorry if that was a bit loud. So key supplements worth knowing about. So quercetin, as we spoke about before, vitamin C. But again, just be careful if you are taking that with ADHD medication, or don't take it with ADHD medication. DOA enzymes can be really good, taking about 15-30 minutes before meals. Magnesium can be kind of, again, really great for kind of calming the nervous system, supporting sleep, energy and brain fog, right? There's different types of magnesium. If you're working with me, we'll be figuring out what one works best for you. Other supplements we've discussed, so we might be kind of thinking about vitamin D is a popular one, B vitamins, particularly kind of B6, omega-3s and fatty acids. You can also get omega-3s through kind of oily fish, so your salmon, your mackerel, your anchovies, your sardines and your herring. This is not a take all of these supplements to fix yourself kind of conversation. These are just some of the ideas and some of the things that we can talk about. It's always worth having a conversation with me if you're working with Project You, or kind of with a practitioner that you're working with. So a note on methylation. It's lucky that we're all neurodivergent here and we understand these things, right? Cats. All right, so a note on methylation, because I have spoken about methylation before. So some people with MCAS also have kind of variants in their methylation pathways, the body's recycling systems for many critical functions, including histamine clearance. If you've heard about MTHFR variants, this is what people mean. It's about kind of methylation. So again, here, the methylated B vitamins can be more helpful, but in some people, they also trigger reactions, particularly in the early stages. So you have to be quite careful, okay? So with all of this guidance, it's important to kind of go slowly, or kind of go slowly with guidance. So go slowly, working with your doctor, working with your health practitioner, working with your nutritional therapist, right? If you want more kind of on diet and nutrition, and you're watching this on YouTube or anything, or kind of with kind of Project You, comment low histamine diet and you'll get out some kind of follow-up resource or just a follow-up message, and kind of, you know, we'll put you on our list for when we develop more things, right? But we don't have so much resources right now. We're doing the best we can, but you know, comment low histamine diet and we'll kind of follow up with you or send you out some follow-up resources. You can get in contact with Project You for any upcoming work on nutrition for neurodivergent women, or kind of just, you know, the deep dive on food is a whole conversation in itself, right? So I'd rather do it properly in a one-to-one than rush it too much here, because, you know, I'm 17 minutes in to this webinar at this point. So at this point, kind of who's missing from the conversation, representation always matters as well with any work that we do. So I just want to spend, you know, a couple of minutes just thinking about who doesn't get represented in this conversation, including this webinar, right? Because this isn't about kind of checking a box. It's about having an honest conversation about MCAS, and the kind of the broader conversations around chronic illness, and where the significant gaps are in who gets seen, who gets listened to, who gets helped. And, you know, it's always important to think about systemic change in all of this, right? Because a lot of us are getting failed because of, you know, systemic issues of us kind of not being picked up, of us not being heard. And as neurodivergent women, we will face a lot of this kind of injustice anyway, right? Not being truly understood, kind of a lot of our symptoms being put down to anxiety or depression, or kind of or that's just your ADHD talking kind of thing, right? So I think it's important to think about kind of skin color and presentation as well when we think about MCAS, because a lot of the imagery online shows it on kind of white skin or lighter skin. So if you're kind of a lot with the flushing, the redness, the hives, the rashes present differently on darker skin tones and are routinely missed in clinical assessment. So this means black and brown people with MCAS are more likely to be diagnosed later, less often, and less often or after longer suffering. So for practitioners, if you're watching this, educate yourself on how dermatological skin presents across skin tones. Mind the Gap is a really great book, and it's a handbook of clinical signs for those with kind of darker skin. And it's a real kind of starting point for this. For those black and brown people watching who think your symptoms aren't being taken seriously, you might be right. Get in touch if you want some support with that. Men and non-binary people. So this webinar has been more attuned to women and those who identify as women, but MCAS affects all genders. This conversation is, sorry, one moment. This conversation is dominated by women, partly because women are more often dismissed and have to fight harder for the answers, but men get MCAS too. Non-binary and trans people are particularly underserved by current research, which is often outdated, which often uses outdated gender frameworks. For trans people who are on hormone therapy, most estrogen mast cell relationship is relevant in ways not yet studied or not yet well studied. And if you are not a cis woman watching this, these principles still apply. The research has not caught up with you yet, and that's a failure on the research. That's a failure on the system, not of you. Okay. Access and class is another kind of barrier here. The pathways I've described in this webinar is significantly more accessible to people with the resources. So if you can pay for private clinicians or private consultations, you might be more likely to get the diagnosis or get the medical support, right? Or get the quality supplements and be able to buy the fresh food daily, right? There is a part of this which is, around access and class. It's very easy to say, hey, let's just buy fresh food and cook fresh food daily, right? But that is about money. That is about how many spoons you have that is about kind of being able to be an enabled body, that a body that's able to do that every day, a brain that's able to think about that, or if you are able to get the support to do that. And pacing your activity cost earnings, time to research, advocate, switch GPs, cost and emotional capacity. This is systemic injustice, right? This is not a personal failing for those of us without resources. And for the practitioners that might be watching, the patients you don't see in your clinic include people who couldn't afford to make it through your door. And it's always important and to be mindful of that. And again, just touching on this briefly, I just want to say again, the low histamine diet, supplement protocols, and pacing approaches can all interact badly when there's eating disordered history or kind of current disordered eating. The MCAS world the MCAS world online sometimes encourages increasingly restrictive eating without flagging the mental health risks. So if you have eating disorder history, your treatment plan needs to hold both your physical health and your relationship with food kind of within that, because both matter and both are equally important. So what this means for how we work, if you are a practitioner, you have to think about who you are not seeing and why. If you have MCAS yourself, your story is always valid, and so is the story of the person who didn't make it to this webinar. If you are researching this for someone you love, that person matters, and so do the people whose loved ones don't have someone researching for them. So just to close up now, 3 things I want to leave you with. If your health has changed, it's not your neurodivergence. Investigate it. MCAS is a multi-system condition that disproportionately affects neurodivergent women, but it is treatable. The path forward is systemic, paced, and supported. There is no quick fix, but there is a real way through, right? I don't want to leave anyone feeling hopeless. We can always do the things. Now, if you are with me online and you have questions, now is the time for questions. If you are watching online and you've made it this far, thank you. Feel free to put any questions into the comments below on the YouTube, or get in touch with us via the Project You Academy Instagram, and you can message there and one of us will get back to you. My name is Whitney Isles. My website is whitneyisles.co.uk. Thank you for being here, and I will hopefully see you again next month. For those of you on the chat,